friend, welcome to the session of Wellness, Wonder and Learning. Today I am going to discuss about the improvement in stroke recovery. That is, when someone has a stroke or situation, heart attack, then what kind of exercises may help you to improve the stroke recovery? My dear friend, short intense burst of exercise may improve your recovery. New research shows that a high intensity interval training HIIT may improve cardiovascular fitness in stroke survivors. Compared to moderate intensity exercise, participants who performed HIIT doubled their cardiorespiratory fitness as measured by VO2 peak. Both exercise groups still showed benefits. Further, underscoring the importance of exercise during stroke rehabilitation. So, exercise is the essential to stroke recovery to regain your motor function and mobility. Improving cardiorespiratory fitness is very important and it helps to prevent additional strokes and hospitalization. When you improve your cardiorespiratory function, then probability of re-stroke is reduced to very less. Research on the exercise for stroke rehabilitation has largely focused on low to moderate intensity cardiovascular exercises to reap these health benefits. However, what the new research says, we will see here. The high intensity interval training, that is HIIT, may be superior for developing cardiovascular fitness in stroke survivors. What happens when your cardiovascular system gets strengthened? At the same time, your lung also gets strengthened. Then you get very less chance of repeating the strokes. However, what the new research says, we will say that we can build strength and we can give flexibility and we can work on balance. But if you do not have heart capacity and lung capacity to do things like walking and climbing stairs, then you are missing a big part of the puzzle. As the senior doctors say, what we find in the study that HIIT resulted in much greater improvements in fitness levels compared to the traditional moderate intensity exercise. That is, when you do moderate and traditional exercise, then there is chance of improvement. But when you do intense high level of exercise, including cardiovascular exercise and your respiratory exercise, then what happens? It improves your recovery. Now, Tang and a team researchers oversaw a 12-week randomized controlled trial comparing HIIT to the more traditional workout regime of moderate intensity exercise. The trial, which took place between 2018 to 2024, included a 8-week follow-up period for a total 20 weeks of observations. The participants included 82 people who experienced a stroke between 6 months and 5 years before the start of the study. The average age of the participants was 65 and 39% were female. Most participants were white. Half of the participants were randomized to HIIT training, while the remaining participants participated in moderate intensity continuous training MICT. Both training regimens were conducted 3 days per week and over the 12-week period, but varied in duration and intensity. The HIIT protocol involved 10 rounds of 1-minute intervals of high intensity exercise defined as 80 to 100% heart rate reserve HRR, alternating with a 1-minute low intensity intervals 30% HRR for 90 minutes. The moderate intensity protocol involved 20 to 30 minutes of moderate intensity exercises 30 to 60% HRR continuously for the entire duration. After 12 weeks, the group that participated in HIIT had improved their cardiorespiratory fitness by twice as much as MICT group. To define cardiovascular fitness, researchers used a measurement called VO2 peak, similar but not the same as VO2 max. VO2 peak is the highest amount of oxygen consumed at peak exercise, indicating how efficiently the body can transport and utilize oxygen in the bloodstream. So, a higher measurement means a higher level of fitness. So, it has been proved that when you do intense training, that is intense high level exercise, then your heart, cardiovascular systems and your respiratory systems both are strengthened, and this gives more strength to your respiratory system, and your respiratory systems can consume more oxygen, which is now again go inside your body, and it heals your cardiovascular system. So that's why high intense exercises are very much beneficial for recovery from the stroke. If you are interested in starting a HIIT regimen, check with your doctor first, especially if you are having a stroke or live with other health conditions. HIIT can be performed with many forms of exercises such as walking, jogging, cycling, rowing, and stair climbing. And what happens? High intensity interval training may be more effective for building cardiovascular fitness during stroke rehabilitation. So, in the guidance of the expert, it is very essential to follow this high intensity training exercises to reduce the again your stroke. That is, your stroke is not repeated, it has been formed. So come and see and how you can improve your respiratory system. Then you can certainly get recovered from your stroke. Thank you.